This presentation is part of a series of presentations on infection control in care homes. The key outcomes are to understand how infections are spread and to understand how to prevent the spread of infection by understanding the core elements of standard infection control precautions. Also, to understand the key principles of reducing the spread of viral gastroenteritis in care homes. The first four presentations focus on the core elements of standard infection control precautions. The first focuses on cleanliness and decontamination. The second focuses on bloodborne viruses and the management of inoculation injuries. The third focuses on the use of personal protective equipment. The fourth focuses on hand hygiene. Standard infection control precautions should be applied in all healthcare settings to reduce the risk of infections to patients, residents and staff. The fifth focuses on the key principles for reducing the spread of viral gastroenteritis in care home settings. This is the third presentation in the series and focuses on the use of personal protective equipment as a means of protecting people from getting infection. PPE is used to help break the cycle of spread of infection. PPE should be chosen based on the risk of transmission of bacteria and viruses to the resident or to the carer, and the risk of contamination of healthcare workers' clothing, skin, by patients' blood, body fluid, secretions and excretions. PPE include gloves, plastic aprons, gowns and masks, and face protection. When you don't expect to have contact with blood or body fluid, you do not need protective clothing. However, aprons should be worn for direct contact with people. If the procedure you intend to do means that you may have contact with blood or body fluid, but you do not think that there is a risk of splashing, you should wear gloves and apron. If the procedure you intend to do means that you may have contact with blood and body fluid, and you think that there is a risk of splashing, you should wear gloves, apron and face protection. Remember that gloves are single use only. You should not wear powdered gloves and you should not wear PVC gloves when dealing with blood and body fluid. If you need to wear gloves because you expect to have contact with blood and body fluid, you should choose latex gloves, as these afford the best protection. If you have a latex allergy or work in a latex-free environment, you should wear nitrile or vinyl gloves. Gloves should be worn before invasive procedures. Gloves should be worn for contact with sterile sites. Gloves should be worn for contact with non-intact skin or mucous membranes. Gloves should be worn where there is a risk of exposure to blood, body fluid, secretions and excretions. Gloves should be worn for handling sharp or contaminated instruments. You should change your gloves between contact with residents. You should change your gloves between different care episodes for the same resident. Gloves should be disposed of as healthcare waste. You should decontaminate your hands after removing gloves by using soap and water. Remember that gloves are not a substitute for hand decontamination. Aprons are worn to protect the uniform. You should wear them when you have direct contact with residents. You should wear them at times when your clothing may become contaminated with germs, blood, body fluid, secretions or excretions. You should change your apron between caring for different residents. And you should also change your apron between different care episodes for the same resident. Aprons are disposable and single use. and they should be disposed of as healthcare waste. You should decontaminate your hands after removing an apron. Gowns are worn to protect the uniform from contamination. It is rarely necessary to wear them. However, you should wear them if you suspect that there might be a risk of extensive splashing of blood and body fluid. You should also wear them if you need to undertake an aerosol generating procedure for a resident suspected of having influenza. Gowns are disposable and single use and should be disposed of as healthcare waste. You should decontaminate your hands after removing a gown. Masks may be worn for a number of reasons. They may be worn to protect the patient from staph. They may be worn to protect staff from exposure to blood and body fluid by acting as a barrier. They may be worn to protect staff from risk of transmission of bacteria and viruses via the respiratory route by acting as a filter for infections such as TB. When worn by the patient, they help to reduce the risk of spreading infection from the patient to others. Surgical or particulate masks may be used. For most situations, a surgical mask will suffice. However, you would need an FFP3 mask if you were undertaking an aerosol generating procedure for a person who is suspected to have influenza or pulmonary tuberculosis. Staff who need to wear FFP2 or FFP3 masks should have been fit tested prior to using them to ensure that they are able to fit the mask correctly and therefore ensuring that the mask protects effectively. Masks and goggles or visors should be worn if there is a risk of blood or body fluid splashing into the face. Masks should be disposed of as healthcare waste, and you should decontaminate your hands after you remove a mask. Further information is available in the Public Health Wales publication, Communicable Disease Control, a guide for care staff. Remember that infection control is everyone's business and everyone has a role to play in protecting your residents.